Oxygen therapy. Indications for oxygen use. A patient can require oxygen for a variety of medical needs. There are 5 typical examples in which the application of oxygen is indicated: heart failure, heart attack, respiratory deficiency, bleeding, complications in childbirth, poisoning. Oxygen delivery system. An oxygen delivery system consists of the following parts: oxygen cylinder with valve. The oxygen cylinders should be inspected daily and pressure tested annually due to the high pressure contents 2000 psi. Low pressure regulator. Flow meter. Oxygen is considered a medication. Therefore, flow meter is carefully used. It controls the flow of oxygen, which is usually administered at between 2 and 20 liters per minute. Appropriate oxygen delivery device. CPR mask. The mask is applied to all unconscious patients. The pocket face mask is designed to aid the rescuer when providing ventilations during CPR. The mask can come both with or without an oxygen inlet. Its use avoids direct contact with the patient's mouth and decreases the chance of contamination. Big valve mask (BVM). Manoresuscitator. The big valve mask is a handheld device you squeeze to ventilate a patient. It comes in adult, child, and infant sizes. All have the same basic parts: face mask, non-rebreather patient valve, a bag, rubber or vinyl. Adjunct equipment for administering oxygen. Nasal cannula. It has 2 stems that are placed into the patient's nostrils. Used most often in a hospital setting, most patients tolerate it well, and it is the best accessory for administration for low concentration oxygen. Flow rate is 1 to 6 IPM. Each liter increases the oxygen concentration by 3 to 4%, in which it delivers 25 to 45% oxygen concentration. Nasal mucous membranes to dry at higher. Non-rebreather mask. Face mask with an oxygen reservoir bag and one-way valves. Requires a tight seal to ensure high oxygen concentration delivery, 10 to 15 liters per minute. Oxygen delivered, approximately 80 to 95% oxygen concentration. Reservoir must always contain enough oxygen so that it does not deflate by more than 1/3 when patient inhales. Must maintain proper flow rate. Delivery system of choice for patients requiring high oxygen concentration. Safety feature: exhalation port is open in case oxygen supply fails. Accessories for ventilation. Oropharyngeal airway. An oropharyngeal airway is a device usually made of plastic which can be inserted into the patient's mouth and curves back into the throat. The airway holds down the patient's tongue and creates an air passage. Procedure for inserting airway. Select proper size. If the patient is a child, use a tongue depressor to help insert the device. Open the patient's mouth. Insert the adjunct upside down, tip facing the roof of the mouth. Advance the adjunct gently until you encounter light resistance. When the adjunct touches the back of the roof of the mouth, turn the airway 180 degrees. Advance the adjunct until the flange rests on the patient's teeth, then secure it with tape. If the patient exhibits a gag reflex during insertion or after it is in place, remove the adjunct immediately.